Hello, Westman, and welcome to one more edition of our show, Café Diversity. This show is brought to you by WCGTV and Westman Immigrant Services. And this show, we take you on a journey to meet all the diverse people that live in Westman and many ways in which they contribute to our community. We're going to hear about their stories, their lives, and the many ways in which they work with the community. My name is Jaime Chinchilla, and I am the cultural facilitator for Westman Immigrant Services. Today, I have the pleasure to have with me Shannon Whaley.
Hello.
And Shannon is a public health nurse.
Yes.
How are you?
I'm good. How are you?
Well, thanks for coming. Can you let us know a little bit about your job? Where do you work at, and what do you do?
Yes. So I'm a public health nurse based out of Brandon. Our office is located on 800 Rosser Avenue. And public health nurses in the community serve a wide range of needs for the community, and this includes healthy baby programs, postpartum visits, as well as the immunization program. And that's my portfolio, is the immunization program for Prairie Mountain Health.
So the public health office on Rosser Avenue, how does it work? Is it walk-in clinic, or you have to make appointments?
I guess it's a combination approach for all of those things that you've mentioned. People can walk in and they are seen on a first come, first served basis, as well as each, I'll say, family in Brandon or individual is assigned to a public health nurse based on their geographic location, and therefore that family can connect with that public health nurse to set up an appointment as well. So it's a combo approach of walk-in as well as appointment-based.
Okay, and you've mentioned few programs. If you can,
yes,
you give us a little bit more detail, and also let people know what can they do at a public health office and what can't they do.
Okay, that's a really good question. And I should also say that public health services are voluntary. So they're not mandatory. But as far as other programs, we would have, our main programs would be like the immunization program. So that would include school programs, as well as the influenza program. So that plays a big part in our lives right now. So that would be the flu clinics that we hold here in Brandon, for instance, would be a part of that. In addition, we have sexual health programs there. We have a diabetes heart health program through public health. So those are some of the services that would be offered. And as we had mentioned, people can just access them through calling the public health nurse that they're assigned to, or they can walk in.
Good. So as I said in our introduction, we look at many different people stories in this show when they have to do with immigration and cultural diversity and all that. And of course, I imagine that being in Brandon, the public health office has had some impact over the last few years with immigration. Can you speak to that a little bit?
Definitely. The public health nurses work very closely with families, as I've said. So part of that would include liaising with immigrant families who could perhaps be new parents, for instance. They could just be walking in to access services for immunization, for other reasons. So the public health nurses work very closely with families and clients in Westman. We have a bit of an outreach approach to some of our areas as well, such as Westman Immigrant Services with the flu clinic that we will hold there, as well as Maple Leaf. We do have a flu clinic there as well, for instance. So I think we would all like to be more involved, but sometimes it becomes a matter of resources and capacity. So,
of course. You're here today to speak especially about that flu clinic that you just mentioned, because you want to get the message out that it is important for people to know and to go to these clinics.
You bet.
So when are these flu clinics happening?
Right. So these are public health flu clinics that we're holding. They will start on October the 18th, which is a Saturday, and they'll be held at the Nurses Residence Gym, which is at the Brandon Regional Health Center. Okay. So those are walk-in clinics. You do not need an appointment. People are encouraged to show up as long as you do bring your Manitoba health card. That's all that we ask. And for those clinics also, there is free parking that is available at the hospital in the front lot. The clinics will run for approximately 1 week. And then following that, we do have a series of outreach or equity clinics. And those would include clinics such as the Westman Immigrant Services, Maple Leaf Foods, for instance.
Now we're going to go rewind a little bit, because I know there are a lot of people that watch this show that are not familiar with this either, because they come from another country or from another community. So what is this clinic about? What is the whole awareness issue about flu and why people need to get this shot and all that?
That's a really good question. Every year, about 10 to 20% of the population does come in contact with the flu virus or develops the flu itself. For those that aren't aware, it is a respiratory virus, not the common stomach flu that we are often thinking it is. It's very contagious, and the awareness that we're trying to get out there is that the flu isn't just a matter of getting sick. If spread, it can cause, for some people, serious complications. It can be the difference between going to work and being at home for 10 days. It can cause some serious health repercussions for certain populations. And so we are trying to spread awareness about getting the flu vaccine, which is a very safe option. It is free for all Manitobans to get as well.
Now, flu, a lot of people, including me, because I have done in the past, confuse the flu with the common cold.
Right.
And how are they different? And why is the flu more dangerous, if you want to put it like that?
Good question. So with your common cold, some of the symptoms that you might be familiar with would be, your running nose and watery eyes. It usually goes away within a couple days, hopefully. With the flu, we're looking at a few more symptoms on top of those. Muscle aches, for instance, extreme fatigue, so much so that some people are actually unable to get out of bed or function. Nausea for some people is a symptom, but not always. That's usually with kids that we'll see that. The flu can actually cause some people to have more serious problems as well, like pneumonia, for instance, or bacterial infections. So that's a real problem.
Yes.
And hospitalizations as well for some people, and even death in really vulnerable populations.
Now, being that complex virus that you're talking about, I imagine that there are some populations that are more prone to get the virus and also more, in a risk situation,
Yes.
if you will.
Definitely. So every year, Manitoba Health actually highlights a list of the specific individuals who are most likely to be at risk for flu complications. We certainly encourage everybody to still get the flu shot, but these include people that are over 65, anyone that lives in a personal care home, for instance, anyone of Aboriginal ancestry, young children, definitely, from 6 months to 59 months of age. Anybody with a chronic health problem as well is encouraged to get the flu shot, and anyone that is pregnant as well.
Oh, so pregnant women are okay to take the shot, because that's one of the questions that a lot of people have.
Definitely, and I think it maybe is a misconception for some people out there, but it is safe. The vaccine is safe in all stages of pregnancy.
Okay. Now, the fact that public health is involved tells me that it is, a very important issue to keep people safe. And that's probably because it is easy, actually, to get the virus. How is it spread?
Good question. So for most people, the virus is spread through droplet, which basically means someone coughing or sneezing on you. Other ways that it can be spread, though, are through touch, so touching an inanimate object, such as a surface like a doorknob, for instance, and then touching a mucous membrane like your eyes, your nose, or your mouth is another way to spread that. Some people don't realize that the flu virus can actually live on your hands, too. So if you were to shake hands with somebody and you hadn't washed your hand, it is possible to spread that if they were to touch their eyes, ears, or eyes, nose, and mouth, I should say. So it does live for 5 minutes on your hands.
So there's basically no way to avoid that except maybe getting the flu. Now, is it like 100% effective, this shot, or is it not?
Good question. So a lot of people ask, is it effective? And we usually say that it is effective for the vast majority of people. Some studies that are out there will say between 50 to 80%. It just depends on which study. It depends also on the person's immune system. So for some people, if they have a weaker immune system, their response may be a little bit muted. It doesn't mean we don't want them to get the flu shot, though. But there is a high level of efficacy for most people.
Now, usually when you talk about vaccines and immunization, I remember when I was a kid and I went to the hospital and took, a few shots, and also when I was a baby, I don't remember that, but I have my marks.
Yes.
So,
yes.
How often do you have to take this flu shot? Because I know that it's not only once.
That's right. Good question. So the flu shot is actually an annual shot, and the reason for that is because flu viruses are really nifty, hardy viruses, and they actually can mutate over time. So every year we actually have to give you another flu shot so that we protect you against the most relevant, most common strains that are circulating.
So that means that there's not one single virus. There's a lot of different flu viruses.
In every
out there?
flu shot, actually, there's 3 different kinds of killed virus. So I just want to specify that because there is not a way that you would get the flu from the shot. But there's 3 killed viruses in each flu shot. And they last approximately, we say usually between 4 to 6 months on average, which takes you to the next flu season then.
Good. Now, you mentioned before that it is safe for most of people to take the
Yes.
shot, including pregnant women.
That's right.
Who shouldn't be taking it?
Actually, it's very few people. The only people that wouldn't take it would be if they had a severe allergic reaction to a previous dose of a flu shot. And in a very small number of people who've had a history of something called Guillain-Barré syndrome. We would have to look at that individually, but a small number of people wouldn't get the flu shot if they'd had that in the past.
Now, a lot of people also worry about the side effects.
Sure.
What are people going to get once they get the flu shot? Are they going to be sick for a day, or that's more like a myth?
Well, I like to say that sometimes we have what are called old wives' tales, which for some people they would say the flu shot makes them sick. That's actually not possible to get the flu from the flu shot. But many people will have what's called a local reaction, meaning a little bit of tenderness or redness, swelling where the needle actually goes in. Some people will feel a little tired or achy for a couple days. Those are all normal side effects.
Now, because there are effects, it's interesting to know what's on the shot, what is actually on the shot, what is going in your bloodstream.
Good question. So we talked about the different strains of the flu virus. So there's 2 different kinds of flu that are caused by flu A in the vaccine, as well as 1 for flu B. So there's 3 strains altogether. You're getting also water, you're getting a little bit of preservative in there just to keep the vaccine itself clean. And generally, we have to do that because we want to make sure with our multi-dose vials, we're not introducing bacteria into the vaccine.
Okay. Now, and probably a lot of kids are, afraid of getting the shot. Are there any other ways to get the shot and to get the vaccination, other than taking a shot?
Yes. So this year in Manitoba, actually, kids between the ages of 2 and I'll say 17, so old kids, are now eligible to get something called flu mist, which is a form of the vaccine that's given intranasally. So it's actually given through the nostrils, so people don't have to get a shot if they're eligible for that. Yes.
And you said that's from what ages to what ages?
Sorry, the ages of 2 years to 17 years.
Okay, so
Yes.
pretty much all minors can take
Most
this,
minors,
except for the under 2.
You bet. As long as they don't have any, we say contraindications, so there's no health reasons that they can't get it, most people that age are eligible for that flu mist.
Interesting. Now, we have been talking about the flu and about the flu shot and all that, but as I said before, with all this diverse population and immigrants in our city, I imagine that you do an extra effort to spread this word among this population. What are you doing at Public Health to get to those people that maybe do not speak English or maybe are not aware of, or because they just arrived to Manitoba, etc.?
That's a good question. So from a resource perspective, we are always trying to find new ways to liaise with the immigrant population in Brandon. I will say, though, we tend to rely quite heavily on our partners. So for instance, yourself, for instance, at the Westman Immigrant Services or some of the other staff there. We also are able to partner with the immigrant population just by virtue of our work with families. So the nurses at Public Health play a heavy part in that as well. And so that may just involve having lots of good conversations about vaccines in general, as well as keeping healthy, providing some translated resources. We do have access to some resources that are translated, not as many as we would like.
What are the usual languages that you translate things to? Like people can go to your office and get a pamphlet or get information in what language?
Well, we definitely have English and French, but for the most part, we don't have a lot in Mandarin and Spanish. We are working on getting more of these resources, but we're happy to say that we have lots of flu resources in different languages. So.
Yes. We talked about vaccination and the flu shot, but there are also other kinds of vaccinations that people get.
Yes.
And we also mentioned that the flu shot is something that you are supposed to take every year.
Yes.
Or it's best to take every year.
That's right.
Because the virus changes. Is this vaccine a part of the immunization program, let's say for kids and all that, so you will keep records of it on your card, or is it out of that program?
Good question. So all the vaccines that are given in Manitoba are actually kept on a computer database so that we can log those over time. So in addition to that, we also provide clients with a paper copy from their immunization visits so that they can keep their own records for themselves. But there are many vaccines that we have available in public health besides the flu shot. So
yes, and when I ask that, I'm thinking about kids that go to school and they might be getting the shot at the school, and then the parents can also take them to the clinic.
Yes.
So you have a way to track that and make sure that people are not getting the flu shot several times.
We do. We do. We try very hard to keep our data as up to date as possible. And I'll say, anyone that hasn't attended public health in the past but would have records from another doctor's clinic, for instance, they can bring those records to public health and we will update them and make sure everything is up to date on the computer.
Now, it's interesting coming from a different country that, in a lot of countries now it's a standard practice that some of the most dangerous illnesses have vaccination and it's free, but some others are not. For example, the flu shot.
Right.
In many countries it's not free. So you can, in Manitoba it is free. I'm interested to know since when, and if you think that it's going to keep that way in the future.
Yes, I do think it will keep that way in the future. It's been since the late 2000s that it became free. In the past, it was that we had to charge people that didn't meet high-risk criteria for the flu shot, but now it is a universal program, and I don't anticipate that that's going to change.
Okay. And you said that it's also a volunteer program now.
It
we
is.
encourage people to do it, but
Yes.
people don't necessarily have to do it.
That's right.
Is it the same with all the other immunizations?
Yes. Although in public health, we strongly encourage everybody to get the vaccines for which they're eligible. There are no mandatory vaccinations in Manitoba.
So are there other important vaccines that are not free that people should think about taking?
Yes, so vaccines that are not free, an example would be if people are going to be traveling, they may want to follow up with the travel health clinic, for instance, in terms of talking about things like hepatitis A and hepatitis B, typhoid, yellow fever, those kinds of vaccines.
Now, for those vaccines, you will have to ask your doctor, or would the doctor recommend it on a regular basis to new patients? I'm asking from the newcomer perspective because it's confusing sometimes.
I'm sure it is. Certainly some doctors will recommend vaccines specific to travel purposes, but we do encourage people to go to the travel health clinic in public health because there's 2 travel health nurses that are specifically trained to address what vaccines anybody would require or would think about needing if they're traveling, for instance.
Well, having you here is really good because all these questions are coming to mind now. And I imagine, if I don't have kids, but I imagine families sometimes might be stressed about coming from another country, and maybe not having the immunization records for their kids, or maybe having them but being not sure of what means what with the other language. What is the best advice for, let's say, a mother or a father that want to get their immunization records updated with their kids and the family in general?
Definitely. So if they are comfortable coming down to public health, we would encourage them to do that. Certainly they can also call the public health front desk, 578-2500, and they will be directed to the public health nurse for their area, who is then happy to set up an appointment, and that can include things like updating immunization records.
And a common question that might come to the mind of people doing this is, what happens if you don't have the record? What happens if you don't remember? Is it dangerous to take a vaccination 2 times, or is it not? Or is it,
Almost never would it be dangerous to take a vaccine 2 times or more than 2 times. Vaccines are very safe in Canada. They're very well studied. And the recommendations, national recommendations specifically, is to revaccinate wherever there is the possibility that the records have been lost or people aren't maybe aware of what they may have had in the past.
What have you found on your daily work at public health with the immigrant and newcomer population? Are they coming a lot for their immunizations, and are there any countries that are really good with that, or are others that are missing a lot of those?
It's hard to say, and I think that speaks largely to the different diversity in our community and the languages that are out there. And I think some people who are more comfortable speaking English will certainly be more likely to attend public health. But for those that aren't, we do have the ability to access interpreters. So we're happy to book appointments with interpreters so we can encourage everybody to come to public health.
Great. Have you found that it is that there is a cultural barrier when you talk about immunization with different cultures, or is it pretty smooth?
It's very hard to say. I think sometimes in some cultures, perhaps if people have come from situations where they may have had a negative experience with immunization, and I know that in some countries there are some mandatory requirements as well, so it depends on people's experiences.
Mm-hmm.
That would be my question.
It's more like in the individual. It
Exactly.
depends on the individual.
Exactly.
Mm-hmm. Interesting. So let's go back once again, because I want people to have it clear that they can go and get the flu shot at different locations and
Yes.
different times. So you're making it easy for people. Do you want to go over again slowly so people can, and we also have that on the screen with our poster and all the information.
You bet. So our main public health clinics are again being held at the Brandon Regional Health Center in the nurses' residence. It's the gymnasium. There will be signs directing people on the day of. That starts on October the 18th between the hours of 10 a.m. and 5 p.m. Okay? No appointment is necessary. People can just walk in and get their flu shot. We just encourage everybody to bring their Manitoba health card.
And this is again for everybody.
This is for everybody, you bet.
Person, not only newcomers, not only workers, it's for everybody.
That's right.
And
so
I'm saying that because on this show we always talk about those,
Yeah.
but
Yeah,
mhm.
those clinics will run all week long, with the exception of the Monday, Tuesday of that week. So we encourage people to come out to those clinics, and there will be interpreters there as well during certain business hours. And then further to that, the week after, we do have, as I said, the outreach equity clinics, and some of those locations are the Westman Immigrant Services building. And that clinic is October the 28th between the hours of 11 and 3.
Do you do any of those at any other large organizations like Brandon University or ACC or anything like that?
Have we advertised at them?
I mean, the flu shot clinic like that? Like
Yes,
the one
we would like to expand the clinics that we do. In the past few years, what we've found is that to get, I guess, as many people immunized as we can resource-wise, we tend to stick mostly with our large clinics based out of the hospital because we have a large team of nurses there that we can safely immunize a large number of people at once.
Great. So if you were an employer, you mentioned you work with Maple Leaf because there are a lot of newcomers there and it's a good place to do a clinic. What happens if there are other employers out there that also have a newcomer population among their workforce and they want to get at least information? Can they come to your office and set something up? Or
They can definitely access resources from us, whether that's fact sheets or information about the flu. We may not always be able to go and provide a clinic there, but we can certainly be a partner with them and can sort of direct them and maybe their employees as well as to where to go to access the flu shot.
Great. So it's been good having you here, and I've learned lots about the flu and the shot. Anything else that you would like people to know before we close?
I just want to say that please consider getting your flu shot this year to protect yourself as well as your family and your friends. And it's free. It's a great time to get the flu shot. And as I said, the clinics start October the 18th.
And you have mentioned something really interesting before I close, that it is not only to protect yourself, but sometimes you might have someone that you want to protect too,
That's right.
like a baby or a senior, an older person, or a pregnant wife.
That's
or
right.
There are many different options why you should take, even if you're a healthy person, right?
Exactly.
So thanks for being here. This is Shannon Whaley from Public Health, and I'm Jaime Chinchilla from Westman Immigrant Services. This is Cafe Diversity. Thanks for watching, and see you next week.